Angle brachial pressure index. The ankle brachial pressure index is an inexpensive, it's actually a non-invasive diagnostic test that is most highly sensitive, and it is more specific for peripheral artery disease, and those who are nearly affected individuals or the people those who are having symptoms of peripheral artery disease or those who are not having the symptoms. That angle brachial pressure index is an accurate predictor of poor diagnosis. So commonly that angle brachial pressure index of 0.90 or less are diagnosed, or they are highly risk of developing peripheral vascular disease, and it is very important to note that angle brachial pressure index can be difficult to measure in patients those who are long-standing like bus conductors or teachers, and the patient those who are affected with the diabetes, or any older patients those who are having any calcification in the cough arteries and not compressible by the blood pressure cuff. Recording of ankle brachial pressure index. So first we should make the patient lie in a supine position, then measure the systolic blood pressure in both arms, and then measure the angle systolic blood pressure from left to right, the dorsalis pedis and posterior tibial arteries. And then value of one angle is taken from the higher of the dorsalis pedis and posterior tibial readings. The angle brachial pressure index is calculated by dividing the highest angle pressure by the highest brachial pressure. So how we have to calculate the angle brachial index? So right angle brachial index equal to highest pressure in right foot divided by highest pressure in both arms. Here we can see the measurement interpretation, that is angle brachial index value interpretation and recommendation. So the value is greater than 1.4, that is 1 to 1.4, the vessel hardening is normal, and there is no need of having any treatment. And even 0.9 to 1, the reading is acceptable, no need of having any treatment. And the value between 0.8 to 0.9, the patient may have some arterial disease, and there is a greater risk of developing peripheral artery disease. And if the value is 0.5 to 0.8, it indicates that the patient has a moderate arterial disease, and we are supposed to refer the patient to a vascular specialist. And if the value is less than 0.5, that indicates the patient has a severe arterial disease. So better very fast we should refer the patient to a vascular specialist, and further treatment should be taken. Coming to the management. So the management, initially we have to start with antiplatelet. It helps to thin the blood, and further it prevents the clot formation, and a lipid lowering agent, it will reduce the cholesterol level, antihypertensive drugs to reduce the blood pressure, thrombolytic agents to dissolve blood clots in the peripheral artery, and anticoagulant will thin the blood and prevent the clot formation. Mainly we should rule out for the patient having any diabetes mellitus. And the main thing, make the patient to do the exercise enhancing the circulation and help with the control of the peripheral artery disease. And food care, the main purpose of food care to prevent injury. And the next thing is modify lifestyle factors so maintain a proper diet, weight control, so cessation of alcohol, tobacco, and make the patient to active, and regular exercise regimen should be practiced, and reduce stress level to improve quality of life. Then finally we will go for an angioplasty. It helps to avoid surgery and relieve symptoms.